Guillain-Barré syndrome, or GBS, is a rare disorder. It occurs when the body's immune system mistakenly attacks the peripheral nervous system. This system connects the brain and spinal cord to the rest of the body. While GBS is not contagious, it can be very serious. GBS can cause muscle weakness, paralysis, and even respiratory failure. GBS can affect anyone, regardless of age or gender. However, it is slightly more common in men than in women. It is crucial to understand that GBS is rare. The chances of developing this condition are low. Despite its rarity, GBS can be frightening. It often develops rapidly, with symptoms appearing over a few days or weeks. Early diagnosis and treatment are essential for improving outcomes and reducing the risk of long-term complications. With proper care, many people with GBS recover fully. However, some experience lasting effects like muscle weakness or numbness. Understanding GBS is the first step towards seeking prompt medical attention if you or someone you know experiences its symptoms. The initial symptoms of GBS are often subtle. They may include tingling or numbness in the extremities, such as the fingers and toes. This tingling sensation can feel like pins and needles and may gradually spread to the arms and legs. As GBS progresses, muscle weakness sets in. This weakness typically starts in the legs and spreads upwards. It can affect both sides of the body, leading to difficulty walking, climbing stairs, or even standing. In some cases, the muscle weakness can become severe, leading to paralysis. Paralysis can affect the arms, legs, facial muscles, and even the muscles responsible for breathing. This is why recognizing the early signs of GBS is so crucial. If you experience sudden tingling, numbness, or muscle weakness, especially if it starts in your feet and moves upwards, it is vital to seek medical attention immediately. Early diagnosis and treatment can significantly improve outcomes and reduce the risk of serious complications. The exact cause of Guillain-Barré syndrome remains unknown. However, it is considered an autoimmune disorder. This means the body's immune system, designed to fight off infections, mistakenly attacks healthy nerve cells. Several factors can trigger this immune response, though the exact mechanisms are still being researched. The most common trigger is a prior infection, particularly bacterial or viral infections. Examples include Campylobacter jejuni, a common cause of food poisoning, and the influenza virus. While extremely rare, vaccinations have also been identified as a potential trigger for GBS. However, it is important to emphasize that the risk of developing GBS after vaccination is extremely low. The benefits of vaccination in terms of preventing serious and potentially deadly diseases far outweigh the minimal risk of GBS. Other less common triggers include recent surgery, trauma, and certain underlying medical conditions. However, it is important to remember that most people exposed to these triggers do not develop GBS. Diagnosing Guillain-Barré syndrome involves a combination of assessments. Doctors will take a detailed medical history, conduct a physical examination, and order specific tests to confirm the diagnosis and rule out other conditions. One of the key diagnostic tools is a lumbar puncture, also known as a spinal tap. This procedure involves collecting a small amount of cerebrospinal fluid, the fluid surrounding the brain and spinal cord, for analysis. In GBS, this fluid often shows elevated protein levels. Another important test is an electromyography, EMG, and nerve conduction study. This test measures the electrical activity of muscles and nerves, helping to assess the extent of nerve damage. Treatment for GBS aims to reduce the severity of the immune system's attack on the nerves and manage the symptoms. Two main treatment options are intravenous immunoglobulin, IVG, and plasma exchange, also known as plasmapheresis. IVIG involves administering high doses of healthy antibodies from donors, which helps to suppress the harmful immune response. Plasma exchange involves removing the liquid portion of the blood, or plasma, and replacing it with donor plasma, or a substitute. This helps to remove harmful antibodies from the bloodstream. The prognosis for GBS varies depending on the severity of the condition and how quickly treatment is started. Most people with GBS experience significant improvement and recovery, often returning to their previous level of function. However, recovery can take time, ranging from weeks to months, and some individuals may experience long-term effects such as mild weakness or numbness. Early diagnosis and treatment are crucial for improving outcomes and reducing the risk of complications. If you or someone you know experiences sudden tingling, numbness, or muscle weakness, especially if it starts in the feet and moves upwards, do not delay seeking